Good afternoon and good morning, everyone. Thank you for joining the webinar, People Who Are High Utilizers Learning Community, Assessing IT Capacity and Integrating Data Systems to Enable Data Matching and Analytics. We'll get started in a few minutes to allow for additional sign-ins past the hour. Thanks. Good afternoon, good morning, everyone, and thank you for joining us for the webinar, People Who Are High Utilizers Learning Community, Assessing IT Capacity and Integrating Data Systems to Enable Data Matching and Analytics. This is the third session in a series of virtual events in our learning community for the Justice and Mental Health Collaboration Program grantees. My name is Hadley Fitzgerald, and I am a Senior Policy Analyst here at the Justice Center, and I will be moderating today's webinar. To give you an overview of the webinar today, we'll start with some introductions, then I'll turn things over to Robert May of the IJIS Institute to briefly review what we've covered so far in the last two sessions of this learning community, as well as to have him introduce new material on data integration solutions and new soon-to-be-released tools, the Integrated Data System Checklist and the Vendor Selection Program Brief that will help you assess IT capacity and integrating data systems to enable data matching and analytics for people who are high utilizers. Then we'll hear from a JMHCP grantee in Lafayette Parish, Louisiana, specifically Dr. Holly Howitt of Beacon Community Connections and Ann Pyle of ADP Solutions about their effort around data integration and its features for people who are high utilizers of their justice and behavioral health systems. At the end of the webinar, we'll have time for your questions and answers. Before I begin with introductions, I want to display a few polling questions we have for all of you who are attending the webinar today. These questions will just help us get a sense of where you're located and what type of agency you represent. So you should be able to see the questions on the right-hand portion of your screen, and we'll give you some time to answer these questions. And WebEx will be able to tally the responses, and I'll report back the results in a minute. I'll give you time to do that now. Great, so our poll has closed, and we're seeing the results. You'll be able to see the results in the same area of your screen. It looks like we have a pretty good mix of folks. Looks like predominantly from the Midwest, and predominantly from those who answered, looking like from urban areas, 28% from urban areas, and a mix of different systems that you represent. Let's see, county jails and courts are strongly represented, as well as community-based behavioral health providers. So that's great to see. This is helpful information to have as we go. We also have a nice showing of people representing from police departments. So thanks for that. It helps us to know our audience. So now we'll turn to some introductions of our panelists today. We're excited to have 3 panelists joining us on the webinar today. Robert May, Program Director at the IJIS Institute, Dr. Holly Howitt, Executive Director at Beacon Community Connections, and Ann Pyle, Managing Partner at ADP Solutions. And before we move on, a few housekeeping items. During the webinar, you can ask a question by typing it in the Q&A panel on the bottom right-hand portion of your screen, and we'll respond to any technical questions as we go and keep a running list of content-related questions and hold those until the Q&A. First, some brief information about the Justice Center, which I think many of you are already familiar with. We are a national nonprofit, nonpartisan organization that develops research-driven and consensus-based strategies to increase public safety and strengthen communities. We engage in consensus building, original research, policy change, and providing expert assistance at the intersections of criminal justice and behavioral health. We seek to break the cycle of incarceration, improve health, opportunity, and equity, and expand the knowledge base of what works to improve public safety. The Justice and Mental Health Collaboration Program, also known as JMHCP, as many of you know, supports cross-collaboration between criminal justice and behavioral health entities to support people in the justice system who have mental illness or co-occurring substance use disorders. And the Bureau of Justice Assistance is the funder of JMHCP grants, and here you can read their mission statement. Now I will turn things over to Bob to learn more about the IJIS Institute and their areas of focus. Bob?
Thank you very much, and welcome everybody, and I hope everybody's staying healthy and safe. The IJIS Institute's a nonprofit alliance, and we work with the goal of enabling technology in the public sector to expand the use of information sharing while keeping information safe. We do this by bringing together practitioners from your world, as well as the technology solution industry, also called vendors, to the table to work on solutions, to hear each side's issues with technology, to result in a better system using standards so that when you change vendors, you don't lose your system and have to start over, and to enable interoperability. Next. Our focus areas are criminal justice, law enforcement, corrections, public safety, including fire, EMS, homeland security, health and human services, school safety, and transportation. When we originally were formed by the Justice Department in 2001, we were strictly a law enforcement focus as a result of 9/11. but as you can see, we've expanded to practically all sectors and domains. Next. This is just a sample of some of the project areas that we've performed projects on recently, including corrections, reentry information sharing, justice and health information sharing, gang intelligence, health and human services interoperability, and prescription drug monitoring programs. Those are the ones I sort of highlighted that are sort of relevant to today's topic. Next. Today, we're going to talk about well, before we start on today's topic, I wanted to refresh with what we were talking about in sessions 1 and 2 in case you were not part of those sessions. Next, Hadley. Hadley, were you going to speak to this slide?
Yes, thank you. I was on mute. Thanks, Bob. So yeah, as we mentioned earlier, this is the third in a series of 4 webinars of the learning community, people who are high utilizers. And since JMHCP grantees are at various stages of planning and implementation of their people who are high utilizers efforts, each webinar is designed to be more detailed and advanced than the previous one. So today's webinar is on assessing IT capacity and integrating data systems to enable data matching and analytics. The last webinar will be on September 24th on applying data to improve performance and identify early interventions and prevention opportunities for people who are high utilizers. I want to mention that all of the webinars are being recorded and will be available to view and share through the Justice Center's website, including the first 2 that are already up on our website. Today's webinar may be of particular interest to share with your IT teams within your agencies or jurisdictions, so we'll be sure to share that when it's available. Now I'm going to hand it back to Bob to briefly review what we learned to date from this learning community in the first 2 sessions.
Thank you, Hadley. In the first session, initially we were talking about how you define your high utilizer population and what kind of resources you require to be able to develop that definition and then identify resources. And we use the definition of people who frequently cycle in and out of emergency room shelters, crisis centers, justice systems, also known as high utilizers. And of course, your focus area may be a subset of that or similar to that, mentally ill who encounter law enforcement frequently, various aspects of that. But obviously people who have a high encounter rate and usually complex issues that you're trying to address. Next. We also discussed how to identify data required to define that population. And before you can begin planning any kind of information sharing or actual integration, you need to know what data you need and where that data can be found. Depending on the issue that your agency is focusing on, some of that needed data elements for high utilization may include number of police contacts, homeless shelter stays, detoxification center frequency, crisis center visits, residential treatment stays longer than a certain number of days, substance use disorders, overdose episodes. So we provided this simple table as just a way to identify in the first column your required elements, second your primary sources for that data, and the third additional or alternate sources where that data may also be found. You're sort of basically building a map of how you're going to accumulate and use this data. Next. In addition to identifying data sources, we also want to determine the agencies you will need to partner with or become part of your governance group. Since this is one of the earlier steps in the process, most of you are already probably had done this even before you applied for your grant, but this slide is just an example of the potential agencies that may be involved in your efforts. Next. Once you know what agencies will be part of your project, you'll need to catalog the information systems that contain the data and identify and track through identify and track through utilizers. What you see here is a simple log again that tracks that information. You identify on the left your partner agency, the center is whatever kind of system they're using to hold their case management information or jail management and law enforcement records management systems. And it's always good to list the versions of software if you know them as well, because a company may have 5 or 6 versions of software, and that could become relevant when you get into actual data integration. And then your system description, a brief description of what that system is and any unique aspects of it that would be helpful to know. Next. In the second webinar, we were joined by Dr. Faye Taxman of George Mason University. We discussed facilitation of information sharing across partner agencies and the continuum. Part of that discussion included the big elephant in the room, the privacy restrictions on information sharing across justice and health, including HIPAA and 42 CFR Part 2, as well as state and local statutes that may also have to be followed. So we talked about who they are applicable to, who is exempt, and how agencies around the country are trying to address that so they can share as much information as possible without violating any of those. Next. Now today we want to focus on data integration solutions, and of course there's a lot of ways to do that. We're just going to talk about 4 today. CSG is developing a couple of resources that Hadley mentioned earlier in the webinar, and we'll talk about those more as we go. But today we'll talk about 4 solutions and the advantages and disadvantages of those, just to give you a general high-level understanding about what they are. And later we'll hear from Dr. Holly Howard from Lafayette County about their reentry coalition. Next. Combining data from multiple information systems, data integration. We need to be on the same table or the same page when we're talking about data integration, so we decided just this basic definition: provide a unified view to enable analytics tools to produce actionable business intelligence. The purpose of this is to get as much data on these individuals from as many sources where they're known to go, so you can develop some kind of picture about their level of use and so forth. So data integration is a way to do a lot of that with machines instead of manpower. Information sharing is when you do it without the use of computers, and data integration, in our view, is when you're using computer technology to try to combine the data and call out what you're looking for. Next. Hadley?
Oh, Bob, first, before we go on, I wanted to take this opportunity to pause here for our second live poll. These questions, we're hoping to get a sense from the audience, if you've begun a process of integrating data between criminal justice and behavioral health systems, and if you have, or if you plan to do so in the future, what you anticipate some of the biggest challenges to that might be. So you should see the questions in the right-hand corner of the WebEx, and we'll just pause for a minute to see the results. Thanks. So we're closing the poll now. And 47% have started to integrate data across these systems. And looks like the majority, believe the concerns will be about privacy and system security issues. Additional selections that were made were stakeholder engagement and technology capacity issues. So thanks so much for taking the time to do that. I'm going to hand it over to Bob again to review data integration solutions. Bob?
Thank you, Hadley. There are many ways to integrate data, and today we're going to discuss 4 of them and their benefits and liabilities. Your agency should determine what solutions fit your needs, including budget and IT capacity. The decision of which way to proceed may also depend on a number of factors. Your governance group may decide as a group rather than an individual agency deciding, and funding may also come from contributions from the group as well as or an individual agency. The 4 solutions we're going to talk about today are Data Warehouse, Data Mart, Data Lake, and Federated Query. Next. First, Data Warehouse is a technology that aggregates structured data from multiple sources so it can be compared and analyzed for greater business value. Just think of it as a large warehouse where all kinds of research reports, documents, statistics, JMS, RMS data, case management information is contained. And the data is usually pumped into the warehouse from the contributing agencies during the night when the traffic to the systems is lowest, so there's less burden on each individual system that's putting the data in. It's an automated process of putting the data in, and it's pre-programmed, so only that data that you want to go in goes in. And it tags the data to know what's already in there and only updates the new information to the warehouse. Since it's structured, the data is arranged in relational tables and have unique identifiers, so you can identify individuals, and it includes identifiers from the various agencies. Your contributors all may have different identifying numbers or characteristics for individuals, but it captures all of that. You can later add artificial intelligence or machine learning if you want to further benefit from the data. Some of the advantages includes it stores the data in an organized way, and the data is archived. Data is captured in one place for easier access to query. You're able to clean the data so it's more accurate, and reports can be saved for reuse, and including other ad hoc reports that can be generated. Some of the disadvantages include it requires significant developer skill to create the relational tables, and data can be hours old. Since it's dumped in usually once a day, you might check on there and find out there's an open warrant on an individual, but that individual could have been arrested in the last 24 hours since the data feed, and you would not know that. So you have to be cautious for law enforcement to not take any law enforcement action based on a data warehouse feed. Next. This is a diagram, generic diagram of a data warehouse, and it shows you in the center circle an example of numerous data elements and types of data that could be in there. And then the satellites around the circle would be your contributing agencies, the members of your stakeholder group, like county behavioral health, law enforcement, county jail, whatever the groups are, service providers, whatever groups are part of your group would be the people feeding that data. Those arrows represent the feed at night and not the user's access to it during the day. That would be a different pathway. Next, please. Next, we want to talk about a data mart. And as you can see in the diagram in the bottom left corner, data mart can be part of a data warehouse, but you may also start with the data mart and eventually add on, build to it over time and end up with the data warehouse as well. A data mart is an arrow or storage for usually a single project, purpose, or department. So, maybe your community supervision may just be part of one data mart. and jail and police arrests may be another data mart. So it's a narrower focus of information. It's smaller, less expensive, less complex to create, but then they can build and they can feed into a data warehouse or be part of a data warehouse from the beginning, depending on how you design your architecture. Advantages: they're easier, faster. Data still captured in one place, easier to clean up. A lot of the similarities of a data warehouse, just less information from broader sources. Some of the disadvantages include it requires the ability to conceptualize what answers you want from the data. Data, again, can be hours old, and results may be limited due to a smaller pool of data. It won't answer all of your questions, for instance, about how many encounters the person may have had in behavioral health if you're in a data mart that's all about arrests or all about supervision. Next, please. Next, we'll talk about a data lake. And it's called a data lake because basically you just throw everything in. Unlike a data warehouse, which has many rules and requirements, a data lake stores raw data and data that has not been cleaned or formatted. Basically unstructured data such as emails, documents, PDFs, Word, videos, photographs, graphics. Much of that data may not even be labeled, so you may not be able to get useful information out of some of it. For example, you may query about an individual that you've encountered, and you might come up with the police information or recent arrests, but it may miss other information that's in emails or texts because it was unstructured and the system wasn't able to identify it. And it also includes things like mug shots and so forth that also may not be labeled, so it may be in there and you don't know it's in there. What can you do with a data lake? You can create a data warehouse from the data. You can do artificial intelligence projects with it. You can experiment with machine learning to create regression analysis or predictive research to try to gain additional insights. But it's really not what you want to answer your day-to-day questions, I don't think, about how utilizers. Some advantages is it's easy to set up since there are few structural requirements, and it's easier to discover data not previously known or to be available. But it is more difficult to learn everything about a topic because it's not structured and labeled and organized. And it requires technical skill to find ways to classify a lot of that unstructured data. And then next, finally, we're going to talk about Federated Query. And basically, to establish you need to establish a federation to be able to do federated queries. And again, that would be like your governance group of your stakeholder agencies who would agree to be part of the federation. And basically, this enables you, when it's built, to retrieve real-time data from the various agencies' systems that are participating in the federation. The data doesn't move from their system, it stays there. And when you do the query, sort of like doing a search on the internet, it goes into their system and looks for the data you've queried according to the rules set up in the federation and the user rules the individual may have. So one person may have access to everything, another one may only have access to less private data. But the point is, the data, it comes out in a view, so you can view the data, but you have not moved data from their system. Some of the advantages, data is current and up to date because you're checking their system live. As long as their system is up to date, it's up to date. The participants maintain control of their data, so obviously agencies like not having their data leave their premise or their cloud. Sealing and purging data when you get court orders to do that is much easier because you don't have to go out to another place to seal or purge a person's data where you shared it, say, in a warehouse, because it's not in a warehouse, it's in your system, and you clear it in your system, and that's the end of it. And there's no need to move data or replicate data, and you don't have those nightly movements of data like we talked about before. Some of the response time is usually less than 6 seconds. Depending on how it's built, it can even be much faster than that. Disadvantages: participating in the system is down. You may not be aware when you do your search that county behavioral health was down, and you may get a negative on the guy you're looking for encountering mental health. It may not come up because their system happened to be down. So depending on how you build the system, it may not alert you to that effect or that fact. And there can be leakage of specific records, illegal searches, and so forth. And of course, that's an area of security that you would build to make sure that can't happen, and have audit logs and so forth, so everything is accountable. Next. And this is just a table just to sort of compare data warehouse to a data mart, since those are the two that probably are most appealing to you and your purposes. And a data warehouse, central location stores consolidated data from multiple sources. And the point is to support business intelligence, to give you information that you can act on or plan for, or make other arrangements, or develop treatment systems to respond to what the data is telling you. And captures data from multiple sources and allows collecting the data from multiple sources and analyzing it. Repository at a data mart is a repository of a particular community of college, a narrower silo, so to speak. Objective is just to do something with the data around that particular topic. Captures data from a data warehouse, even in operational systems or external sources, and keeps it in that little narrow bucket. That allows storing data relevant to specific purposes. Next, Hadley.
Thank you, Bob. So before we get into the next section, we would like to pause here for our third and final live poll. You'll be able to see the question in the bottom right-hand portion of your screen. Just want to get a sense of what data integration option seems like the best fit for your jurisdiction. So we'll just give the poll 1 minute. So we've closed the poll, and now we'll calculate the results. So at 30%, the biggest response went to data warehouse as the option that seems like the best fit for your jurisdiction. Very interesting, thank you. So thanks for completing the poll, and we're going to get into the next section now, which will get an overview of the integrated data system checklist.
Thank you, Hadley. The checklist that's coming in October. Hadley, were you going to speak to this? I'm sorry.
Sure, yeah, I'm happy to. So what Bob will be going over in the integrated data system checklist is to explain the ways in which it's a tool, it's a checklist that will help you evaluate your current IT capacity to integrate data. It's part of the BJA Justice and Mental Health Program. This will be a publication of the Justice Center with support from IJIS, scheduled for release in October 2020. So I'll let Bob, go into detail on what the checklist can provide your jurisdiction.
Thank you, Hadley. The checklist is a tool that lays out steps that you need to achieve your goal from concept to user access. It will require input from operations staff, IT staff, analysts, and administrators or managers to complete, as you see when you see these various topics. The completed checklist will inform you and your IT developers or vendors, prospective vendors, by describing where you are and what steps are yet to be completed to get to a data integration situation. The checklist will help you schedule steps to get to your desired state and will inform budgeting and your fund-seeking process as well. By completing the checklist, you'll gain a better understanding of your own current IT capabilities and limitations. I'm sure, unless you've worked with your IT department before on something similar, you probably wouldn't know how capable they are of doing this already, or they are already doing it, or not doing it, or do you already have a vendor on staff who, or under contract that's doing something similar? So it helps you sort of filter through all those questions and sort them out, and gives everybody a better understanding of where you're at and where you need to be and how big the gap is. The more accurate of view that you have of your status, the better your bidding process will be if you go to a vendor, because the more accurate information they have, the less money they have to build into their bids for the unknown, because they always do that to protect themselves. So the more information they have, the more precise the response to proposals can be, because they know exactly or pretty closely what you need. Next. Checklist is divided into the following topic areas: system preparation, planning, vendor selection, working with stakeholder agencies, implementation, testing and modifications, training, and management, maintenance, and build out. Next, we'll go over each of those briefly. Next. The purpose of the system preparation section of the checklist is to assess your readiness to proceed. Focuses on objectives and requirements to define success. Defining your high utilizer population, your partner stakeholder agencies that need to be at the table. Have you formed a governance group? Have you established your system outcome goals? Have you already identified your system functional requirements? Do you have an inventory of your stakeholder agencies' case management systems, like we showed you earlier in the slides from the previous webinar? Do you have agreements with your stakeholders to share their information? Have you already decided on what type of approach you're going to use? Just basic questions to help you start to get focused on what you want to do. Next, please. Project startup section assesses your work plan status. What does success look like? Who will host your hardware and software systems for the data integration? Have you created tasks and timelines? Have you developed your work plan? Identified hosts for the servers? Negotiated agreements for information sharing with your partner agencies, MOUs, or business agreements? Have you decided what solution you plan to do for data integration? Have you decided how to secure the data? And have you identified your funding sources? Next, please. Vetting vendors highlights the key things you need to know about potential vendors. Do they have similar solutions in other jurisdictions already? Do they have experience integrating justice and health data in addressing using HL7, FHIR, or CCDA or NEAM standards? Do they have vendors have systems running in both criminal justice and health fields already, so they're familiar with your terminology and your systems and your project? How do they comply with privacy regulations in their other similar projects? And do they have references from similar projects so you can talk to peers about not only their capabilities, but also their satisfaction with working with the agency personnel. Next, please. Working with stakeholders assesses your partnerships and governance structure and readiness. Do you know the IT contacts for each of the agencies you'll be contributing data to your warehouse? Has the server security been planned? Has the governance group defined access privileges for various users and roles of the users? Sometimes this is a focus area of projects and not the technical aspects because it's obviously more familiar with practitioners who are trying to do an IT project. But it's really important because once you get your system running, your users are going to have to have access, and you do not want people having access to data that they shouldn't have. So good planning is really important here. Next, please. Implementing integrated data capabilities talks about the implementation readiness. Have task leaders been assigned and charged with various assignments? Is hardware, operating systems, and security systems all working? Are you staying within scope of your project? Making sure everything is on track and not allowing scope creep and other issues to slow you down. Next, please. Testing and modifications is about required testing and plans to make changes based on test results. You want to test system performance and speed and transitions, security against roles based on HIPAA and 42 CFR and so forth. You need to test the systems from the contributing agencies that are either putting in information or the systems being used to access to do the queries by their users to make sure their browsers and their systems are working with the data warehouse or data mart or what system you're using to make sure that's all working. Can't just be tested from the host agency. Next, please. This section assesses your training readiness. This is an area that's really important and it's often overlooked or just not thought about a lot in the early days, and you need to do it. To get full benefit from data integration, it's critical that everyone be trained on the use of the system, and your IT managers are trained on how to manage and maintain the system if you've hired somebody else to build it. We've seen cases around the country where data warehouses go virtually unused because they didn't train users sufficiently and people don't know how to use it, don't know they have credentials or so forth, and you don't want to get in that situation. So in addition to doing all the training, you want to also be sure to either in your contract have your vendor develop or that your staff develop user curriculum and handouts, cheat sheets for using the system. We all know there's a lot of turnover in our agencies and you need to have those resources available. So when people you did train move out, you haven't lost everything, that there's resources available for the next group coming in, and that you do have periodic trainings beyond startup. So when you do get new people on board, you have that training available and you have a training guide or training curriculum to use, and that all your agencies use that same curriculum. So everybody's on the same page about what it is and how you use it. Next, please. Finally, maintaining your system after it's operational. It's basically technical project management going forward. You may have IT people do that, but you as a practitioner will also want to be a part of that. Have you developed help desk capabilities so when people do run into issues or concerns or breaches or problems, that there's a path for them to pursue to find the answer to their question. It may be a help desk where there's pre-designed materials that respond, like FAQ searches. Your vendor may still be retained to be able to answer questions, or your IT department, just a resource for the users to find that out. And now I ask Hadley to introduce the program brief.
Thanks. Yeah, so in this section, we'll get an overview of the vendor selection program brief. So this is, oh.
Go ahead.
Yeah, I just wanted to mention that as with the checklist, this is a part of BJ's Justice and Mental Health Collaboration Program, and will also be released by the Justice Center in October. And, you know, it will support jurisdictions in selecting an IT vendor for their high utilizers project, which is touched on in the checklist. But I'm going to hand it back to Bob so he can go over what this document will look like more in depth.
Thank you. The program brief describes how the checklist is designed to get your successful project underway. The successful acquisition of integrated data capability requires a defined scope of work in the RFP if you're soliciting a vendor, or a contract that supports collaborative and cooperative working relationship for your well-qualified vendor if you're going that route. A well-defined scope of work, as I mentioned earlier, will help minimize problems and reduce delays caused by change orders because it wasn't well crafted early on. Next, please. Some key questions that the brief will answer for you. The types of information you'll need to include in the RFP. What kind of integrated data repository do you want? What should be included in the scope of work for the vendor? What critical activities are needed? When looking at vendors, as I mentioned previously, check your current vendors in your area, talk with your peers about who's doing work in their area. Have they built similar data integration solutions before? To just see where your pool is. You know, you can look online, but that doesn't tell you a lot. Everything's wonderful when you're looking at a website, but you really need firsthand experience to get the real deal on certain capabilities. Next. After reading the brief, you'll be able to develop a shell of your project implementation schedule. You'll have much of the content, at least for background of the status of your current system. You'll be more organized and prepared to develop your integrated application, and you'll be able to assess the progress toward implementation. You'll also, as I mentioned, get more accurate responses from vendors. Bids will likely be less due to fewer unknowns and shortened timelines, again, because of you've done this homework. Next. At the end of the brief will be a sample vendor selection tool, and it'll basically help you call out the key qualifications that you should look for in vendors, their experience and so forth, as we've mentioned, and only ask for the requirements you need. One mistake a lot of people make is they call up all their peers and other similar agencies and ask for their RFPs, and then they just sort of add together all the things they ask for with the things you want, and you end up with a more expensive system that takes longer to build because you're asking for things to be done that you really don't need, that your neighbor might have needed them, but you don't. This is one thing that the industry tells us all the time, that people, it's hard to develop an RFP from scratch, so they cheat a little bit, and you got to be careful. You can compile your great big list, and then you can have your governance group go through it and cut out what's not needed by you. And with that, I'll turn it back to Hadley.
Thanks. So we're now going to take this opportunity on today's webinar to showcase the work of a current JMHCP grantee from Lafayette Parish, Louisiana, to learn more about their data integration project. I'm going to turn it over to Dr. Holly Howitt and Ann Pyle.
Hi, thanks, Hadley. So we're very happy to be here. And wow, that was some great information that Robert was sharing. I'm so happy that those resources are out there. A few years ago, around 2015, when Lafayette Parish started looking at how we could integrate data, there was nothing like that. We kind of had to build stuff as we went along. And for a long time, we just shared information just on a case-by-case basis, and we're still doing that. But through our latest Justice and Mental Health Collaboration Grant, a good portion of our funds we're using to begin to do some data integration projects. And one of those is working with Salesforce to build a customized case management system for the project, but then also we wanted to figure out how could we get information sharing between law enforcement and behavioral health agencies and us so that we could do that. And so we're working on our first phase of that, which is linking our law enforcement partners with us. And so, like I said, we've been working with Salesforce and with a partner with Salesforce that could really customize Salesforce to make it what it is for us. So I'm going to turn it over to Ann for just a few minutes to kind of talk more the technical features of that, and then I can kind of finish wrapping up with kind of how we're planning to use that. So Ann, you want to kind of share a little bit about the technical aspects of what we're doing?
Sure, be happy to. So what we built for Beacon Community Connections is basically in two parts. One is utilizing Salesforce to provide them with a robust case management system that allows them to track information about their clients and also to track what those clients' needs are and how they're interacting with them. So many of these folks are in pre-diversion programs. Some of them are coming directly out of jail. And so her staff is able to, on a regular daily basis, track all those activities related to the cases that they are managing. What we're currently doing is we are extending that out to the Sheriff's Department at this time. So the Sheriff's Department has referred a lot of cases over to Beacon Community Connections to track their pre-diversion program and also their folks coming out of corrections. And so what you're looking at on screen is a dashboard that we've created for the Sheriff's Department users to take a look at through a portal, basically. So this is a portal in Salesforce. It's called Community Cloud, which gives them secure, this is a HIPAA-compliant platform, it gives them secure access to information that they can see, that lets them see how many cases they have, how long, what the ages of the cases are, if they've been disqualified, what reasons they were disqualified. And then there's also a special focus on mental health needs. How many of those needs did we identify, and how many of those did we actually meet? So that's the basics of what this platform does.
So, and thank you, Ann. And so we're just basically, we're building it right now. We're going to do a demo with the Sheriff's Office next week. And then once we have one partner that we feel comfortable with, we'll be moving that out to other partners. On a side project that just came up this week, one of our partners is the local hospital system here, and they're very interested in integrating our Salesforce platform with their electronic medical records, which is Cerner. And so they were talking about stuff, and I heard heard you mention the acronym CCDA. I didn't know what that was. I'm still a little bit confused about it, but they want to try to figure out how to use CCDA to share information for actual feedback loops on the people that we're working with.
Yeah, and so because Beacon is working with multiple entities, not only law enforcement and pre-arrest diversion, but also hospitals, they really get a nice view from, of this particular person who's gone in and out of ERs, has been in and out of a hospital, a psychiatric hospital, has been in and out of jail. So it's a really nice way of collecting community-based data that gives you a broader understanding of what's happening to these people.
Yeah, I'm happy to answer any questions if anyone has any specific questions for me, Hadley, or for Ann.
Okay, great. Thank you. Thank you both so much. It looks like we do have some time left in the webinar today to take some questions. So go ahead and be chatting those in. taking a look at what we've got. So looks like a question from a jurisdiction who maybe hasn't begun data integration yet. What will I say to people in my county worried about this higher level of data sharing in terms of consumer privacy? So I'll throw that out to all of you to answer. I know that's a big topic.
Hadley, did you want me to answer that?
Sure, yeah. I mean, how maybe, from your own experience, how that was approached in Lafayette Parish, if there were any challenges around that.
I mean, there's always challenges when you're wanting to share data, particularly HIPAA and then the Part 2 data. But really what we spend a lot of time doing and still work on is the relationship building. If you have a relationship with agencies and they come to trust you and the organization that you work for, they're much more willing to come to the table and figure things out. It's also good, I think, to get the lawyers involved early. We made that mistake a couple of times about coming to kind of a handshake agreement, or thought we'd come to terms, and then some lawyers get involved, and lawyers are very risk averse. And so, so that would be my two pieces of advice. When you're trying to build it, it's a slow process, and start small and take the wins as you can get them.
Yeah, and this is Bob. If I could just add on, I totally agree with what you've said. And as she described, starting small and working with your stakeholders starts to build trust, because obviously when you're crossing between law enforcement or criminal justice and the health community, it's like oil and water. You can't know what we know, and so forth. And so there's cultural barriers as well as the privacy barrier. So by starting small, getting some small wins, working together builds trust. And as that trust builds, it usually can lead to a much broader relationship. And one of the nice things about data integration and using technology to share the data is you can build the privacy protections into the technology, so people don't have to make a decision when Officer Jones calls and says, do you know this information over community health? Community health, the person may be afraid to answer because they're not sure of the rules. Well, the system handles the rules for you, so it's actually a little bit safer, and that's one of the things you can explain to the people that ask the questions. The system can be safer than human transferring data, and it also archives a log of everything, so you know who accessed what information, and you can go back if there's been breaches and deal with it.
Yeah, so that's exactly right. So, on the technical side is making sure that you have documented and implemented everything with respect to the HIPAA regulation. So, as you mentioned, making sure that they're monitoring so that you can go in and audit, making sure the data is encrypted at rest and in transit. So there are a number of technical requirements in the rules themselves that really need to be addressed from a technical perspective. And so if you can prove that to a CIO or an IT director and show them exactly how you're complying with the privacy requirements, then you're in good standing.
Well, great. Thank you. Thank you all for answering the question. And we're just about at time. So I just wanted to say thank you to our panelists and to our audience joining us today for the learning community. We have recorded the session, so we'll be sure to send you the link when it's available. Just as a reminder, the next session of this learning community series is September 24th at 2 p.m. Eastern Time. On applying data to improve performance and identify early interventions and prevention opportunities for people who are high utilizers. You see my email address there on the screen. Again, my name's Hadley. Feel free to email me if you have any questions. And thanks so much for joining. Have a great rest of your day.